Yes. Hello everyone, my name is Ganapati. I'm the head of the occupational therapy department. I have my master's in occupational therapy, specialized in pediatrics. So today we are going to talk about attention deficit hyperactivity, commonly which is called ADHD. So when you hear this word, like many places know he behaves like ADHD, means that he's a little hyperactive. He's like he's not sitting in one place. These kind of symptoms they say ADHD. So what are the classical signs, like when you say somebody as ADHD, children as ADHD is three classical signs has to be there. One is that attention deficit. That means inattention has to be there. Second thing is hyperactivity. That means unable to sit and unable to engage in calm activities. And the third one is impulsivity. That means acting before thinking. So now these three things, like inattention, inability to pay attention, inability to sit in one place or engage in calm activities, quiet activities, like schools, and anywhere where learning has to take place, they have to sit and do it. That may not happen. And then third thing is impulsive. That means like they won't pay attention to danger, and then they get into trouble very often. So these are the classical signs of ADHD. Now when you say ADHD, no, there may be some children, they have hyperactivity predominant. That means predominantly hyperactive, lesser inattentive. Or sometimes they may have a predominance of predominantly attention deficit type. Or sometimes you will have only attention deficit, there is no hyperactive at all, then we call that attention deficit disorder than ADHD. So ultimately this ADHD should have all these three symptoms, then only we call them ADHD. Now when do you diagnose the child with ADHD, means in the sense like when you can say really this child is having ADHD is about maybe around 4 years, more than that, 3 to 4 years you can say, because children up to 4 years are generally active, very active. So we diagnose them maybe after 3 years. We can just do some certain what do you say, screening tools or parent questionnaires, and we can diagnose them with ADHD. Usually it will be done by the developmental pediatrician or a pediatric neurologist or a psychologist. Qualified psychologist has to do that. Usually they have a master degree in clinical psychology, or a pediatric developmental psychologist can do that. Now once that is done, such children know what are the problems, why, how it can affect their daily routine is because they are not able to pay attention to details, they are not able to sit in one place, and they are not able to control their impulse. They can have problem in all their adaptive skills, like motor development. Usually they have a better motor, in fact they will be more mobile in hyperactivity. So hypermobile, they will be hypermobile, and their fine motor skills and all looks okay, but they will have a significant problem in socialization. In the sense, they will be over socializing. They intrude into others things. They will not wait for a turn. Like when there is a structure, there is a rule, that the rules, following the rules will be difficult for them. And execution skills, in the sense, the frontal lobe, the left frontal lobe's function is executive skills. That is remembering things, daily routine, daily activities, information related to their work, studies, or whatever it is. They will not be able to remember things. They forget things, they misplace things, they losing things. All these things can happen. and inability to pay attention details, so that it's difficult for them to solve the problems, very anxious about the challenging situation. They will not be able to solve the problem in a quiet manner. And they can also have what do you say, the impulsive behavior, which can affect their social skills. For example, if you should behave in a particular manner in a social situation, that because of this impulsivity, talking out, or acting things which is not appropriate to that place can happen actually. School is another area where they can have a lots of challenges of studying all these things. And apart from that, if you see that children with ADHD, they develop almost like a normal children, unless until it's very obvious hyperactivity. And in adult also, this problem can continue. They can have a problem in executive skills, paying attention. Those kind of things can happen. Organizing thing, do it in a proper systematic manner can be a problem. All those things can be there in adulthood also. And this childhood ADHD problems can be converted into an anxiety disorder in adult. That also can happen as a continuum of this problem. Now, why this is happening? It's like it can have a genetic problem, that in the sense, like from hereditary wise, they can have these genes which is carried on. This can be a problem. Apart from that, there is no obvious problems like ADHD, and it can be a clinical feature along with autism with hyperactivity. Those kind of things can happen. Very rarely have mental retardation, all those kind of things, because it is predominantly the frontal lobe inhibition which is not happening. Because you have your left frontal lobe, which is the master dominant frontal lobe. It's for the right hander, it's a left frontal lobe. It's a dominant lobe. The frontal lobe is controlling the entire brain system. So this will tell, do I have to act or not? This will tell that should I tell that information or not. Since that is the master brain, the undergrowth, the lesser growth of that area can cause attention deficit hyperactivity. So once if you are having a children with ADHD, scholastic performance is a problem, and developmental milestone is a problem. Social issues are there. Usually it is neglected, because in olden days also they say that okay, he is like little overactive child, like that they neglect it. Nowadays, since the competitive school education system, everything is changing, that people have this as a concern. Child is not sitting studying, all those concerns are coming up. So what we do as a what do you say, pediatric rehab professionals, we do a thorough evaluation, as I told, to diagnose the child. And we also have evaluation based on functions. We do evaluations on their adaptive skills, like the gross motor skills, communication, and their cognition and visual motor integration assessments will be done, and their language also will be evaluated thoroughly, and then we set appropriate plan. So the best approach which will helpful for ADHD is sensory integration. In the sense, like they are inattentive because of, say, they are not able to modulate the senses, like multiple senses are coming to you. So which sense I have to give more importance, which sense I have to give less importance, they will have a difficulty in processing that information. And this will be treated by sensory integration approach. If they have a hypersensitivity, hyposensitivity, all these things and all, because they enjoy this movement activity, those things they enjoy it. So we have to, the second option is put them on play. Pre-play is the best way. Put them on like good playing environment, encourage them to ventilate their this thing. Every day they require some way to ventilate it. Some people are physically ventilating, some people are orally ventilating. Find out what is their way of expressing that. And then behavioral management, that is very very important. Positive reinforcement, negative reinforcement, positive punishment. Usually positive punishment is not a negative punishment we can give. In the sense, there are different techniques are there to reinforce a behavior or reduce a behavior. and special way of educating them, environmental modifications, and their daily routine management, and parental education, cognition based behavior therapies also can be very useful for these children. Earlier is always better. Pick up these signs much earlier. For example, even if we say officially we diagnose them after 3 years or 4 years, it's always better to pick up subtle signs earlier and consult a specialist, and you can start something which is early, which can help you. So if you have anybody, like any of your children or your relatives, somebody who have children with ADHD, you can contact us for more in such videos and information related to children and their developmental process and disability. Please watch our channel. Please subscribe our channel and share it with your friends. Thank you.